Hey guys, lucky for me, last week I was able to interview a back specialist called Austin Lawrence, and he's going to be coming up to North Wales in a couple of weeks. So if you'd like to just stay hooked for the next half an hour, it's about 25 minutes of video. Oz is going to explain exactly, who he is, what he's about, and some of the stuff that's going to help you when you come to our seminar on the first week in February. Take a look.
Okay, cool.
There we go. Right. Reason I'm doing this, Oz, is just to introduce you to my clients. Obviously, we've had a little discussion. I was just telling my clients, you guys, about how I met Austin. It was a while ago, and I actually quite sort of hungrily look for people that are better than me to follow. It was on Facebook, and it was a friend of mine, Ben Gray. I was asking him what sort of workshops I should attend, and I thought, where should I go to find out a bit of different things, how to help my clients. And one of my good friends, who's been a trainer for a long time, has said one of the courses you have to do is Austin Lawrence's Back on Track course. Is that one used to be run? You still
Back on Track seminars, yeah, still run it.
Yeah, so that's and, the problem is that Austin's all the way down in Oxford, and we're all the way up here in sunny North Wales. So I thought, instead of trying to get people to come down to Austin, we'll get Austin to come up to North Wales and put on a day's workshop where hopefully he can bestow all of us with some of his absolute incredible knowledge. We met about a couple of weeks ago, and I was really, really impressed with not only just his knowledge as a trainer, but his background. So first of all, let's find out a little bit about you. Crack on, Dogon. A bit about your background.
So I got into I trained as a chiropractor, but got into that because I did a sports science diploma back in '97, and then trying to backtrack, that's what, 15 plus years ago, more than that. So just before I started the course, I got injured, and then just for the whole course, injury after injury after injury, and obviously you're doing a sports course and you can't train, so
do gymnastics and stuff. So
it sucked. And then in the second year, we did a course with the FA, and the tutor, we did like a basic and an intermediate management and treatment of injuries course. And I'm a pretty good drawer, so what I would do was draw every joint, muscle that for the injuries I'd had, label it, rip it up, start again, and it pretty much covered the whole body because I was so injured. That was basically it. And then the tutor was like, wow, you're really good at this. What are you going to do when you finish your sports science course? I said, well, I'm going to go to uni and do sports science. He's like, well, you've just done 2 years. This will be a bit of a waste. You end up repeating. The first year will be a repeat of what you've done. And he said you'll be better going into like sports injuries or physio or chiropractic. And he was just finishing his chiropractic degree at the time. So I'd already had a place. I had 3 offers at uni to do sports science, so I turned them all down. And then I actually applied the next year to be a physio, but everywhere turned me down. I then did a course with Premier, did their personal trainer sports therapy diploma. And as I finished that, I ended up working with him for 4 seasons at a semi-pro football club. So he was an FA-approved physio and also a chiropractor as well. So we worked at the football club for 4 seasons, using his approach. We got people who, they had hamstring and groin problems. You see them on TV, rugby players or footballers. It looks like they've been sniped. They go down and they're out for months with hamstring or groin injuries. We had players like that. They were returning within 3-4 weeks and playing first team football again.
Is that due to your work and his work together?
Yeah, mostly his at the time because he was a lot more qualified than me and experienced. And then he coerced me into doing a chiropractic degree. So I started out in 2001, completely and utterly burnt out. I had a load of food intolerances, would get sort of like 10 hours kip and wake up feeling like death. So I took a year out and then went back. And then by that time, it went from a 4-year degree to a 5-year degree. So I don't do things easy. If I can make something complicated, I will. So I ended up studying chiropractic for 6 years in total. So that was like most of my 20s gone into more education. And I finished that, and then I've done Dax's kinetic chain assessment, all 4 levels now. As it stands now, there's literally about 12, 13 people that are level 4 trained in the UK.
Yeah.
And then running my own back pain workshops for personal trainers, so teaching them how to assess their clients and get them out of pain, using a little bit of hands-on techniques and a lot of corrective exercise.
So a lot of people will know what a chiropractor is. You know, everyone kind of gets a chiropractor, or I know you're not obviously saying you're one of those, but what would you say is the difference between a chiropractor and a kinetic chain specialist? Because this is like obviously a new breed of hybrid trainer stroke, injury specialist. What would you say is a kinetic chain specialist?
But what I found with a chiropractic, even after several years of training, we would get a new client. In our final year, we had to do 40 new patients minimum and a minimum of 400 treatments. And even after all that training, we would still basically say what's happened, and it might be their sacroiliac joint might be locked up. So you might do a 1,000-page report, and it would say their right SI joint is immobile, but it doesn't tell you why that's occurring. And the treatment protocol would be we're going to mobilise it, but with the kinetic chain type stuff and the approach I take now is why is that happening in the first place? If a chiropractor just loosens a joint, it's going to go back and lock up again. What you find is the joint's locking up because that's the only way it can get any stability. So until you sort the muscle imbalances out, which is what the sort of kinetic chain stuff looks at, that's always going to be. The client or the patient's always going to have a sacroiliac joint problem. So you've got to sort out why it's.
I found that on a personal. That's why I was so interested in what you did, because I've been to so many physios. I've been to so many different experts, and yes, okay, I've paid 40, 80, 120 pounds for a consultation, and they've just come back to me and said exactly what I know. Well, this is tight, and this is gonna, this is what maybe you should be doing to come back. They've never really looked at the root cause, and that's from what you just said is really sort of struck a note with me. So I'm excited to see, some of the stuff you're gonna do. What would you say would be like in regards to um, your time in the fitness industry now? So how did you make that jump from becoming like a personal injury specialist to like how did you amalgamate all the things? So you're like a hybrid trainer where you're good at training people, you're good at your back pain, and you've got the kinetic chain stuff. How do you think that's helped you really help clients?
They kind of all complement each other in a way because if somebody isn't moving very well or they got big muscle imbalances, it helps with fat loss doing corrective exercise. Most people's abdominals are not working properly, their muscles of their upper back, they breathe really badly, so their breathing pattern's out of sync, so their fitness is going to suffer. And so glutes don't function properly, so there's a lot of muscle pretty much inactive. So you can do corrective work, and it's almost metabolic in a way, because if you get muscles which have been lying dormant for donkey's years, and suddenly they're working 24 hours, 7 days a week now, you're going to burn more calories. So from a fat loss point of view, the corrective stuff works brilliant. Getting joints more mobile, because if a joint isn't working properly, it's going to switch off the surrounding muscles as a protective mechanism. So getting joints more mobile and some muscles activated will lead to greater fat loss. But at the same time, if someone's in pain, those imbalances are going to be there as well. But it's whether it manifests as pain or not in that person, and often it does. So you find there's a big. So there's a big crossover. You get people. Sort of my nutritional approach is the same whether someone wants fat loss or they want relief from back pain. And the training approaches are very similar because it's basically what does the body want to do. The body is meant to, certain joints are meant to have more mobility, some are meant to have stability. The body doesn't want to be bombarded with toxic foods, it wants fresh, natural foods. So whether someone's in pain or they want fat loss, we do the same thing. Obviously, we progress them slightly slower if they're in pain and use that as a guide. But it's basically getting the body back to health.
So if someone's watching this now and they're like thinking, well, I've been down the route, I've got a little bit of pain here and now and again. Because like a lot of people don't suffer constantly from back pain. I imagine there's different peaks and troughs and when they feel it, how often they feel it. What would you say the main cause of people ending up in this way? Because so many people. I was really trying to find some statistics the other day to support the workshop, and it was like something like, is it like 90% or is it like 80% of
It's about 80% of the Western world will suffer from back pain at some point in their life,
and like
and it's around.
why?
If you do a point prevalence, so at any one point, if you do a study the population, about 30–40% will be suffering with back pain at any one time.
Wow. So what would you say the main cause of this is then?
Um, we're lazy buggers. We sit on our asses too long. That is the biggest cause, without a doubt.
Yeah.
We sit down and our glutes get put on stretch. You know, you need strong, functioning glutes to protect the low back. Most people sit down way too long, and as a consequence, the glutes get put on stretch and they switch off, and we start using other muscles.
So where would be the first place you would start to, like, so someone, it's easy for us to talk about it as trainers. We're, active people. We do a lot. I'm sitting down now. Should be sat on a Swiss ball. I'm not. I've never do that, but well, maybe. But what I'd say, what would be if you were a person looking to seek an improvement in their back health, what would be the first step you would take?
Thing is, because of the chiropractic, like I've gone really away from that because that's just okay. Look, that joint's locked up. Click crunch or immobilize it. Whereas my approach is more integrated, so it's hard to say which one's the most important because the whole program is important. I'd get people sat down a lot less. If they've got a job where they're in an office, then move around. Most people are chronically dehydrated as well, which is going to amplify pain because the body becomes acidic. So if you've got an office-based job, get up regularly, take lots of water, and if you're drinking lots of water, you need to pee more, so they'll be getting up out of their chair more to go to the toilet. But then I would get people, if they're doing that, then it's okay, as you get up, do some corrective stretches, so, stretch out your quads and hip flexors. It takes seconds to do that, so there's small things you can do. And the whole point, I've kind of gone away, like I said, some of my posts on Facebook have a little dig at chiropractic because I want to get people to take the power back in their own hands. Most chiropractic osteopaths, not all, but most, they tell people to don't do this, don't do that, don't go to the gym, and it's very softly wrap them up on cotton wool, and it's basically you can only get better if you see me or the chiropractor or the osteopath, and it's not true. A lot of stuff you have more power to sort your own back pain out than you're told, and that's frustrating for me.
I can vouch for that. I do feel that as a trainer, personally, you can find out also so much so much information online. I say to my clients a lot of the time is that they could go away and do exactly what I do, research and find out, but it's how it's put together and it's how it's taught to them as well. I think personally, as I train people, I like to bestow them with what I know. And do you think that something like back pain, you do feel helpless because you feel like you need to go to someone to correct it, and sometimes it can be quite expensive. And that's really leading on to my next question. Really, you've got someone they've started getting up. They want a really cheap tool to help them with their own back pain. So they come to you. That might be an expense, so an upfront expense. What would be like a tool you would use with them? Maybe like a cheap tool.
My approach is always quite minimalist. I want to get the sort of maximum effect with the smallest intervention, if that makes any sense. So first, I'd rather take things out before adding things in. So if someone's diet is horrendous, we're just going to take out the pro-inflammatory foods like your refined oils, wheat, dairy, sugar, alcohol, neurotoxic substances like MSG and aspartame. If you take those out, pain is going to be greatly diminished, but your chiropractor or your osteopath, your physio, they're not going to tell you that stuff.
No,
Um,
what would they look at for you then?
and then we would start getting them on a healthier diet, so more fruit and veg, pasture, raised animals. So if you eat all wild fish, if they eat fish, so that's going to have an anti-inflammatory effect. Just drink lots more water.
Simple.
Which nobody does. Lots of filtered water or clean water. No sort of fluoride and what's the other one? Chlorine in it.
Yeah,
That on its own is going to greatly reduce pain, but in terms of doing stuff which is cheap, I mean, a foam roller, if used properly, is very, very good because that improves soft tissue quality. A lot of the time, people have got real restrictions in their muscles caused by the muscle imbalances. Some muscles are going to be tight and in a shortened position, and they become all knotted up, so they need rolling. Of course, but then it's doing the right muscles.
Yeah, I know.
You can't just randomly do it because you might you might cause a bit of injury or you might irritate an area. But a foam roller can cost like 10 quid, so that's a cheap tool. So that's a good one.
I'm gonna say because I need to learn it. That's something I'm really, really not that great at. Is my ability to. I know about stretching. I know about facilitation of different muscles, but I'm not as good at the foam rolling stuff. So that's why I'll definitely be chatting to you about that when you're at. Well, so you get clients. I get clients. I get most common questions that I get asked. So what would you say is the most common question you get asked as a trainer or is when someone's actually trying to look at investing their time with you?
Most common question in terms of back pain or fat loss
Yeah,
or
like say you get your average client. What's the most? I'd say back pain because that's what we're specifically targeting. So what's or probably the most common injury you see where it's really easily corrected or simple adjustments you make.
hello, you there?
Yeah, can you not hear me?
Uh, just timed out then. Not sure what happened.
Alright, sorry. Can you still see me? Can you see me again?
Yeah,
Yeah.
yeah, I can.
So what's the most common sort of not question or injury? What's the most common injury or imbalance you see, and you're like, oh, I see this all the time. What would it be, and what's the cause of it?
As I said, sitting down. Most people's glutes get switched off. Most people have got what people say, gluteal amnesia. Some people's are not. They're in a coma. They're just not even working at all. So anytime you do any movement where there's a hip hinge where you're sorry.
Lazy ass syndrome.
Yeah, I mean most people they sit down way too much. I'm sat down now, and I'm gonna have to get up and do a few corrective stretches after this and some glute activation. But most people that we lead sedentary lives, so most people sit down on their commute to work. Even if you cycle to work, you're still sat down, so your glutes are not really doing anything. And then they sit down at work, they sit down at lunch, they sit down after lunch at work, they sit down on the commute home, sit down to watch multiple hours of TV when they get home. They're sat down eating dinner, and then the only time they're not sat down is when they're asleep and no muscles really active.
They go to the gym and they sit down on the bike and watch telly.
Yeah,
Oh,
I wrote, and I wrote sort of an exercise thing. You're fit and strong while you're suffering from back pain. That's on my Facebook notes. People do all the stuff where they might do the stationary bike. They do the leg press, which rounds their lumbar spine, and they do all the mirror muscles like chest press, crunches, and they do all the muscles. They work the muscles which make all the imbalances worse. So you tend to get people who are really dominant in their low back. Actually, that's a good one. Just remember, most people say, "What can I do to strengthen my low back?" But what you find is 9 times out of 10, people they already have a strong enough back. Their low back muscles are the most efficient, and that's why they get in pain. They're doing the job that the glutes should be doing, so they assume their back's weak because it hurts, and then it's that kind of bodybuilding sort of mentality almost that we must strengthen it. We must work that. It's weak. We've got to strengthen it, and it's not true. Those muscles have become tight or facilitated. They're holding too much sort of tone from the nervous system. So every time they do a movement, say like a deadlift or a Romanian deadlift, anything that involves sort of a hip hinge, instead of their glutes and hamstrings doing the work, it's going to be their low back. The load goes straight to their low back every time, and that's why they're suffering a lot of back pain. But there's other stuff associated with that. Their hips generally aren't mobile enough, and then they get tight in their hip flexors, they get weak in their abdominals, and that's the one I see the most. That's the most commonly seen one.
Yeah, everyone wants abs these days. Everyone wants these great abs, and especially you see people coming down. And the biggest question I get asked is, how do you get a little bit of abs at the bottom? And first of all, they come to you with round shoulders and the hips are tilted the wrong way and everything like that. And you first of all, you just need to get you standing properly. I think everyone wants to look good in a sort of in the beach gear, but sometimes it's the good time to be working on how good you look is just when you're sat in your chair. At least I think so many people even
Yeah.
sitting, they've got a poor posture. let alone, I know it's easy for us to say, well, you've got to get up out your chair more, you've got to get out. But sometimes if you're working in a call centre or something like that, they're going to argue with you and say, well, I sit down for a living. So would you recommend, look at how you're sitting and stuff like that? Would that be a big part of it as well?
The thing is, there's no perfect sitting posture. We're told that your knees should be bent to 90 degrees and the screen level with your eyes, and that's better than slouching. But whatever posture you adapt to, whatever posture you sit in, your body's going to adapt to. The soft tissue, like the muscles, connective tissue, like the fascia, is going to shorten to that position. So you're better off moving around. Because after about 20-30 minutes, you get something called tissue creep, which sets in. And that sort of, if you're sat in one position, some muscles are going to be put on stretch. So you'll get creep setting in. The good thing is it's not permanent. It just takes several hours to undo it. So you're better off moving around. So the best sitting posture is one that changes. But that's hard to do if you drive, because if you sat at a desk, you can slouch a bit, then you can be more upright. You can put one leg over the other. You can then do the reverse of that. You can put the keyboard on your lap. But obviously you can't do that if you drive for a living, so you're going to have to kind of sit in the best possible position whilst driving, and then get out.
We've got a driving instructor on our camps, and she has suffered back pain in the past, and what we've been talking about has explained quite a lot, and hopefully I think it will ring true with a lot of people who do like driving. Actually, that's probably the biggest lengthy sit down job you can do. So actually, we've covered quite a lot of my questions without even me going through them, but. So let's talk about February. The first week in February, what we're going to be doing is myself and Oz will be putting on an event in North Wales. It's going to be in Conway. Still looking for a venue, me being me, but we're looking for we're going to be sharing our practice where we're going to do. It's Oz going to be doing the lecturing. We're going to talk about all the things we've talked about, where what sort of foods we should be eating, what sort of pharmaceuticals are not going to help long term, what sort of what things we can buy or not buy or take out of our diet we can use to reduce inflammation. And then we're also going to be doing a short part of that workshop where we're going to be doing actual exercise, actual movement based, and looking at our bodies. So then it's not only what we're trying to do is I think it's like, how long did you say the day was?
It's going to be about 8 hours long. So it's not going to be, this isn't going to be, I'm going to give you a load of knowledge or a load of stuff and say, eat this, don't do this, and then you walk away and go, yeah, but how do I put that into practice? Because that doesn't serve anybody. As I said, my plan is to give people the power back so they're not in a perpetual cycle of seeing their chiropractor, feeling good for a couple of weeks before they go back. This is stuff that you can implement and then take away, use, and get out of pain or drastically reduce it.
I'm excited. Yeah, but that's nice to see. I think we're going to have it's going to be 30 spaces. We're going to have it's going to be obviously a whole day. It's going to be their time. A lot of the people have been asking how much it is. It's going to be 97 for the day. That's the early bird discount. And as we get the numbers towards the date, it's going to be exclusively at first for fast members. So anyone who's a member of the fitness camp. And when the 20 fast spaces are taken up, the cost will be going up to 150. But like I said, you are getting a day with an expert. I know Oz hasn't really had a chance to go through all the stuff that we managed to speak about last week, and I've read quite a lot about information. I've been to different trainers across the country, and I've never been as impressed as I am with some stuff you came out with. So I'm really excited. Apart from that, if you're looking to book on, just get in touch with me at ben@fastwaytofitness.co.uk, and I'm sure we can get you a space on there if we've got any available. Nice one, Oz. I shall be, we'll all see you in February.
Okay, can't wait.